Uganda, though naturally endowed with a tropical climate, is experiencing climate change impacts that take a toll on the quality of life of the people. Regions which are flood-prone, such as northeastern Uganda, are particularly facing sanitation challenges. The Uganda Sanitation Fund, a program of the Government of Uganda through Ministry of Health, with funding from Water Supply and Sanitation Collaborative Council, has over the last 9 years been working to end open defecation in 48 districts. Kole is one of the new districts in northern Uganda carved out of Lira, with a population of about 284,000 people. Kole district has made commendable progress in ending open defecation.
Toilet pe enda mani kyani toilet jodo tiyo ko konyo me mani kyani dong to mara na jodo kentiadi pe.
This is in line with the Global Sustainable Development Goal number 6 of the Universal Access to Safe Water, Sanitation and Hygiene Services by 2030. The Uganda Sanitation Fund focus is on construction of toilets that are adaptive to the flood-prone area.
They are prone to toilets collapsing when it is a rainy season and flooding, but they have done their best. They have used liners so that the toilets don't collapse, and they are there permanently.
New innovations are being applied to ensure that sanitation and hygiene, as well as water safety, is achieved, and human resource skilling has been prioritized to implement the technologies invented.
As entrepreneurs who is doing pit emptying as a business and briquettes, there are other businesses like compost manure, which is also we are making out of the fecal matter.
Behavior change campaigns such as triggering is one of the ways through which communities are encouraged to embrace good sanitation practices. Community members gather to identify their problems and together work out solutions.
People were even running when they see somebody coming for the issue of sanitation. They run away because the approach was they get you without the toilet, they arrest you. So there was no need of somebody putting a toilet when there is insurgents. But the CLTS does not follow issue of arrest. You dialogue with people, people understand and change behavior themselves. It's more of behavior change communication.
Today, as a result of these concerted efforts, latrine coverage in Kole is now at 84%. Working with development partners, the Uganda Sanitation Fund has facilitated communities in Kole to harness the economic and agricultural value in human waste. The traditional pit latrine that has to be abandoned when it is full is now a thing of the past. The people of Kole have significantly embraced the new improved lined pit latrines.
The masons were trained in using liners, the culverts. They are like culverts. You use them to build a toilet or a latrine where there is waterlogged or where the soils are collapsing. The liners hold the soils so that the toilet doesn't warp in.
These innovations come complete with hand washing facilities. They have helped to strengthen the supply chain for appropriate sanitation products and services. This in turn has helped to meet the demand for better sanitation facilities while creating an enabling environment for sustainable change.
What we need now to turn our focus to is to ensure that everybody has a line pit. And also to see that the communities, villages, households are connected to the gulpers, the people who are involved in removing the fecal matter.
Without a doubt, Uganda Sanitation Fund has made great strides towards ending open defecation in districts where there was low latrine coverage. Besides this, it has also led to positive social change that enhances the welfare of the Ugandan people. Most crucially, the Uganda Sanitation Fund has demonstrated that even with limited resources for sanitation and hygiene promotion, government can make great savings with homegrown solutions in order to prevent sanitation and hygiene-related diseases, but also guard against climate change-related disease burden through improved sanitation innovations that correspond with climate change adaptation.